Hello, I'm Sara Darling. This is Intentional Trip, Psychedelics for Modern Mental Health. I'm joined today by the wonderful Ajit Dhillon, Dr. Ajit Dhillon, who is the resident doctor for guided tripping in the Netherlands. Thank you so much for being here today.
My pleasure.
Yes, what can you share with us about your experience with psychedelics, getting into, into this important sacred work?
It was by accident. I had met Miriam while I was overseas, and I found it completely interesting what she was doing. And this was, several years ago. The acceptance of this wasn't really there; it had just begun.
Right.
And just by curiosity, I wanted to know what she did because I myself do a lot in alternative care, and as I'm discovering what she does, how she does it, and these other practitioners, I saw obviously a very keen application to something that is near and dear to my heart. So prior to becoming a physician, I served in the U.S. military, the Marine Corps, and over the past 20 years have had a lot of friends and friends of family that are not coming back themselves.
Right.
Right. And conventional therapy wasn't something that was necessarily working, and it was just kind of a taking a chance and seeing how that could potentially help some of my friends that were battling with PTSD. So with a few of them who were under therapy, under care, under their whether it be a psychologist or a psychiatrist, they essentially worked with them to go under one of just a couple guided journeys that I would do with them over in Netherlands. And after it was done, after a few sessions, which were many months apart, the psychologists and the psychiatrists were saying that we've just jumped years, that I don't think we could have ever come this close to getting this type of, let's not say resolution, but progress.
Right.
And that was so profound for me that I wanted to get involved in that. And,
yeah, definitely. Well, thank you very much for your service.
Oh,
too.
Thank you for your
So specifically when working with veterans and for their CPTSD, how long till they really see a difference in their psyche? What does the process look like specifically with working with veterans when you are guiding a trip?
Sure. So, the first thing is that the veterans have to find us.
Right.
I don't actively go look, although I've gone through enough groups and support groups saying, there's options out there if you'd like to come check it out, and you have, the ability to do so.
Right.
By all means come. There are some cases where I will definitely try to take care of them on my own, and where it's a no-fee situation. But there's a few things. One, we have to look at the severity, how complex this PTSD is. Okay, it may not just be from surviving something in combat. There could be, hey, why did I join the military to begin with? What went on in my childhood? What was I doing? So I've seen progress within one session, which is then coupled with, if they're with a caregiver, again, a psychiatrist, a psychologist, a behavioral therapist of some sort, and then sometimes it can take a couple years. And by years, we don't mean, I don't advocate, I support microdosing completely, but we want to have somewhat of a controlled environment in what their progress is, their session with their provider. So what I like to do, because it all kind of goes into brain chemistry, is that if we need to do other sessions, I like to spread them 3 or 4 months apart.
Right.
See what the progress is. So if I get a veteran, for example, and again, this is completely exclusive if this person needs 1 session or 10 sessions. Okay. Right. We look at the progress. We look at, have you found your better self? Are you where you'd like to be with your life? Is there something about this you may want to hold on to, but you're okay coping with it? The medicine or the psilocybin does what it's going to do, and there's no way for me to predict how that's going to be. But when I do get a veteran, what I do is I do 2 intake sessions. Okay, first intake, we get to know each other. Do I feel comfortable with you? Do you feel comfortable with me? Right. Let's talk about what we want to achieve. Okay, and we may then go to a second session because things are forgotten.
Right.
Hey, I want to add some more things. I thought about things. Great. We'll then go to the journey. Okay. we'll go through it. We'll have intention. We'll have, a talk in the beginning. We'll have maybe a small little talk, towards the end. And then I do an integration, and that might be 2 or 3. With veterans, I don't care how many integrations I need. I have an open line where they can call me.
Wonderful.
Okay, which just takes up all my time, really. but I do that. I think it's important.
It's so important. So important.
So you have to have a responsibility with that, right?
Indeed. Yeah.
And then after that, we just decide. We don't make an appointment. We don't decide if another session is needed. Just the door is open. And if we need to go through this again, maybe our intentions are different.
Right.
Maybe we want to discover something else. But let's at least talk about it. And the idea is that the medicine, the substance is going to do what it's going to do. And that's something I learned on my own as I, about 2 years ago, went through a session myself with Miriam. And I knew what my intentions were before. During the session, not quite sure, but I was able to focus on that, 1 week, 2 weeks, 2 months later.
Right.
And that's where you really, I believe, see the most effect. That's where you can really gauge how you're doing.
Amazing. Yeah. What kind of dosage do you have the vets take?
We start with roughly 1 gram. Yeah.
And working primarily with psilocybin.
Primarily. Yeah.
Primarily.
Yeah. There are other things that can happen, but that's on them. If they'd like to bring anything, and they want to try something, I'm happy to facilitate.
Right.
But particularly with me in Netherlands, it's specifically we keep it psilocybin. Yeah.
What medicines have you experienced? What would you like to experience?
In my youth, I've definitely experienced MDMA.
Yes.
Cannabis.
Yes.
Which I also think has a very important role.
Oh, huge.
In post-integration. A lot of my post-integration, I incorporate a high-dose CBD for a while.
Fabulous.
And it actually is kind of like this lid to like the jam that we've made, and it's really nice. I think I would like to go into a little bit more. I've never done DMT, I think I'd like to pursue psilocybin a little bit more, maybe revisit MDMA. Just haven't quite found the time or moment to do that yet.
So you haven't done ayahuasca?
No.
Great, so you're going to do it in January.
Oh, I don't know about that. We'll see about that.
Well, you're invited, my love.
Thank you.
What, with the psychedelic revolution upon us, what are you most excited for? What are you most fearful for?
I'm most excited about, in my world of looking at PTSD, I'm most excited about a better, or at least an alternative to helping humans live their better life.
Yeah.
Okay, life is short. Don't want it to be miserable. Let's find your better self. And I keep using the term "finding your better self."
Yeah.
That's a quote I took from Miriam. Okay, and so that is what I'm most hopeful for. What I'm most fearful for is, as we've entered an age where cannabis, for example, has been widely now accepted and is going to be more and more normalized, that the same scrutiny that cannabis had over decades is what potentially psychedelics are going to be looked at until we get to that era where it's completely accepted.
Indeed. So Ajit, what can you tell me about the contraindications of medications when working with psychedelics?
It's an absolutely great question, and that's exactly how I help our team in Netherlands. In most situations, it's going to be a safe journey, and we want it to be safe for everyone, for the client, for the practitioner. We want to minimize bad results, potential life-threatening situations, but we also want them to achieve what they've come there for. So I can almost break that down, not just by drugs, but by maybe some situations. Okay, so for example, if you have someone, let's say, who is depressed, PTSD, and they're thinking that this is something that can help, they may already be on, anti-anxieties, antidepressants, okay? Now, these drugs can potentially compete with the substance, okay? So we have to determine, one, is a higher dose going to work? Or is there a time where you can take a drug holiday, off of it? And a lot of these drugs take almost a 30-day clearance, to really leave, and then it's like, hey, maybe now would be a good time. But by doing so, are we also jeopardizing the client as well. Could the client during that process, decide, let's say, have suicidal ideology?
Right.
There are a lot of safety things there that aren't necessarily like a chemical interaction that's going to create like an overdose that could lead to death, but it's more so, what are we doing safely for the person's mental state? What are we doing, for their experience? And vice versa. Is this going to be a safe environment for the practitioner? I can go into a million different things that could compete, but really those are the kind of the guidelines we follow when we look at drug interaction.
Right.
Okay. There's another thing that I look at. I look at physical constitution. Is what is the person's cardiovascular state? Do they have a history of epilepsy, strokes, things like this? These are things that can be potentially the practitioner may not want to be in that situation, which is an unfortunate thing because the client clearly wants to try to do something. Okay, so we have to look at the probability and possibility of an event happening. What risks are both parties willing to take? Depending on their physical state. Okay, and then the third is the overall picture of the client. Okay. Let's say they have a family history of something, whether it be depression or things like schizophrenia. Are they currently in a state like this and they have not been seen by a therapist? We always want people who are in that state, okay, to at least have a map written out by a professional, and there are professionals obviously that we know that can do that. We can certainly refer and recommend, but we want this to be as part of the overall process for the client and not just an end-all be-all. Again, I'm talking under the lens of trauma, PTSD, things like that. Obviously there are plenty of clients that come that truly want to find their better self and discover something that may be untapped. And 9 times out of 10, if they're overall healthy, I don't see any contraindication. And most of the practitioners see that too. They kind of go to me as a lifeline, saying, "Hey, we've got a situation here. What's your opinion?"
Right.
I'll give my opinion.
Yeah. Indeed. So, are there any times that you feel that psychedelics are not a good choice for a particular client?
Sometimes, yes.
Yes.
Yeah.
Yes, with like schizophrenia or?
It depends. It's not necessarily schizophrenia. It's just the level of where the person is. We've definitely encountered a couple of clients that have been very difficult, and what we end up learning from that is that even though we'll do a good intake, the other end of the outcome may not be something that's desirable for the practitioner. Accusations. This isn't what I wanted. This is so there is that where you don't have the experience or whatever they may have thought the outcome may have been. We try to find out. There's definitely some situations you might have someone that is just really unhealthy, has a capacity of 30% with their heart. These are scary things.
Indeed.
Where I have to look at the practitioner first, and not necessarily what the individual wants out of the session. So in that regard, I have to protect the practitioner. So yeah.
Fascinating. Thank you.
You're welcome.
This has been Intentional Trip, Psychedelics for Modern Mental Health. I've been joined by the wonderful Ajit Dhillon. Thank you so very much for being here today, and thank you for watching.